Everyone is on it. They all look amazing and we all want it. Yes, I'm talking about GLP-1. Hi, I'm Dr. Z. I'm a primary care doctor who's been practicing for like 100 years, or at least it feels like that. And I wanted to share my personal opinion about GLP-1 and why I decided not to take it. So everything I share in this video is not a medical advice. It is not even medical facts. Unless something comes out in 10 years and I'll say, yes, I was right about it. But for now, I don't have any data to back up everything I'm wondering or worrying about. So first of all, when it first came out, it was originally introduced or approved for diabetes, and I started prescribing it to my diabetic patients. It is a wonderful drug for diabetes. I would say I have seen hemoglobin A1C decrease from like 13 or 14 and taking insulin 3 times a day and still struggling to like almost none, and then like not even requiring any insulin at all whatsoever. So yes, it is a good medication for diabetes. I did not have diabetes, so I didn't need it at that time. Then it was approved for weight loss. Everything for weight loss we've had so far would have like mediocre effects, like maybe you lose 10 pounds, 20 pounds, and that was it. The only thing that helped you lose like 40 pounds or something was bariatric surgery, gastric sleeve, Roux-en-Y bypass, and all of those things came at an exorbitant cost of surgery, which may not be covered by insurance, cost of hospitalization stay, cost of having all the nutritional deficiencies because your stomach can no longer absorb all the vitamins and iron and everything, and eventually coming with side effects of maybe a stricture, abdominal pain, and a lot of times I saw the weight come back in like 3 to 4 years or 5-6 years or something like that. So yes, there was a lot of excitement when this medicine came out, and because we've never had anything like this. So yes, there was a lot of hype. But as everyone was so excited, I was kind of getting a deja vu in the sense that I feel like, or I can imagine that this is probably how everyone felt when benzodiazepines and opioid first came out, that it was like a panacea. It's a cure for everything. It's amazing. It's good for everybody. It is the best thing that ever happened to the humanity. As a person, I'm a hopeless skeptic. If something sounds like too good to be true, I a lot of time assume that it is too good to be true. So I shared the enthusiasm and everything, and I prescribe it for everyone who qualified for it, who asked for it, who after discussing all the side effects and the lack of long-term side effect data agreed or wanted to take it, or for whom the risk-benefit ratio was worth it. Should anyone take it? In my opinion, yes. I think if you have morbid obesity, diabetes, obstructive sleep apnea, if you have fatty liver, all of those things are great indication for taking it, and yes, it is a great medication to help you with all of that. Having said that, my health odyssey was my weight issue. And being an advocate for preventive medicine and being a fan of lifestyle medicine, I was thinking too hard and looking at all the data and research and everything of why I was like this. So if only thing you have is extra weight, I'm convinced that the weight is not a problem. The weight is an indication of the system you're living in. If you're having weight problems, it shows that maybe you have bad coping mechanisms, maybe you have bad habits you may have inherited, maybe you have there is some kind of dysfunction in your life which can lead to different bad outcomes. Like if you don't have enough fiber in your diet, you could have like colon cancer and stroke and heart disease. If you eat processed food, all the endothelial damage that comes from the processed food can increase your atherosclerotic cardiovascular disease risk factors. And if you do not have essential fatty acid, you're going to have some kind of cognitive decline and or problem with your skin, hormones, sleep, emotional regulation, and so many other things. So in my head, my diet needed to change. if I wanted to live a healthy life, and I could do it on my own. So another reason I didn't feel very motivated to jump on the GLP-1 wagon was that, in my observation, again, not backed by research, in my observation, the patients who lost the most amount of weight also had the worst side effects. So at the end of the day, when I would do the calorie review with the patient, I learned that the weight loss was still equal to calories in and calories out. It's not like it was magically making them improve their metabolism and then like suddenly they're burning more calories or they're utilizing their calories or energies in a better way. No, all it did was that it did affect your appetite quite significantly. It did give you nausea, and the people who had the most significant side effect also had the most significant weight loss. So with all of that, I was like, if it's at the end of the day, it's all calories in, calories out, I can do that on my own. And maybe if I adopt a Mediterranean lifestyle, I'll do it better and eat like in a healthier way. So my other concern was that when the data started coming out about the protein loss, like most of the weight you lose is not just your fat loss, it's also a lot of it is your muscle mass. So for me, it's like, and it's kind of silly if I say that, but I don't know how else to say it. So I'm gonna go ahead and say it. It's like, I feel like I have barely enough muscles to survive. I have barely enough intelligence to get by. I have barely enough skin health to look decent. I did not want to lose any of that. So I was afraid that it would impact my health in a bad way. Like I would get wrinkles, I might get some cognitive decline. That is my personal theory. I don't think there is any data on that. I'm afraid of it. It's not a fact, it's my fear. And also I worry about the loss of muscle mass, because I barely have any muscles as it is. Also, as a person, I'm not good with taking nausea. Like I can barely get on with my day if I have nausea. I did not think I would be able to go to work or be able to be kind to my family and my patients and be a good person generally in a society. It's one thing that really makes me miserable. But having said that, for a lot of us, we are eating for reasons other than being hungry. And there are so many things to be learned from the Blue Zone diet and the Mediterranean diet. And there is so much research and so much data to back it up that if we adopt a healthier lifestyle, there is no reason we wouldn't be normal weight. And for everyone who says they take it for reducing the food noise in their brain, I would say the food noise comes from the eating processed food. If you clear your diet of all the processed food for like a week or something even, you would feel so much better. You're not going to have that food noise. Do you know there is enough research to show that processed food do have chemicals in them that make you want to eat more? The biggest landmark study that came out about, I want to say like 5-6 years ago, it was a crossover study. So 2 groups of people were housed at an NIH facility. They both could eat as much as they wanted to. So the people in the healthy group ate normal amount of calories that wouldn't make them gain weight, but people in the processed food diet ate 500 extra calories per day, which about comes out to like 10 pounds of weight gain per year, which is kind of what we are seeing in the country. But before we all started eating processed food, nobody had that kind of food noise. And in the ancient cultures, they may have been hunting all day for festivals and stuff. Maybe they prepared food all day. Even with all of that, people didn't have that kind of food noise that we have today. The food noise doesn't have to be there. The food noise that was created by the chemicals from the processed food, I didn't think I need to combat it with another chemical. I decided it's better not to eat it. Another thing I hear a lot from the patients is that it just helps your metabolism. I'm not convinced it makes you burn any calories. It's still, at the end of the day, the weight loss I'm seeing in patients is exactly equal to calories in and calories out. And the day you get used to it, So I have seen it in patients like who've been on it for 2 or 3 years. The day that you get used to it and you start eating for all the other reasons you used to eat before, whether it is for celebrating, whether it is for eating out, whether it is for hanging out with the friends and family, if you eat for any reason other than nourishing your body and satisfying the hunger, it will lead to weight gain. The only thing I have seen give people sustainable weight loss is lifestyle changes. If you change your lifestyle, yes, it takes some time, and yes, the weight loss happens slowly. It doesn't go away in one day, but I think it's worth it because then your body has time to adjust to it. Your skin has time to adjust to it. That's my take on the GLP-1 and why I personally decided not to take it. Some of you might be questioning, why do I prescribe it to patients? If you are considering that, go talk to your doctor. And I believe that the medical care should be individualized and specific to your personal needs and your situation. So go talk to your doctor. If both of you agree that the risk-benefit ratio is worth it, then go for it. If you think the risk-benefit ratio is not worth it, then maybe you work on the lifestyle changes first and see how you do with that. So that is my take on it. I hope this was helpful. Okay, I want to hear from you guys. What are your thoughts on GLP-1 and why did you decide to take it or not take it? Or what is your experience with it if you're on it? Also, let me know about other topics you would want me to cover, because I'm a primary care doctor, so pretty much every topic is in my wheelhouse. Give me ideas in the comments below. Bye. Have a nice day.